Hi. So today I want to talk to you about um, mindfulness-based stress reduction for women who are pregnant or postpartum that are experiencing symptoms of anxiety and depression. Um, as we all might know, mindfulness-based stress reduction was a technique that was founded by Jon Kabat-Zinn. It's a practice that's been, going on for about 30 years now. It involves like deep breathing, meditation, and, being present minded and being aware of the situation and what's going on. What I discovered, um, probably personally on my own, in 2015 over the summer, I had a 5-month old. And my experience with my son was a little bit different from my experience with my daughters. I was so protective over him, and to the point where I really became anxious about leaving him. And I was always wanting to know what was going on with him. I was thinking that something would happen to him. And so, working where I work and working in women's health, I never really knew what was going on. I just knew that it was a little bit different, and I had some anxiety about leaving him. And it kind of made me feel sad sometimes. It made me feel depressed sometimes. And during that time, I also was working on developing a support group for moms here at the hospital because I was getting more and more consultation for patients that was experiencing symptoms of anxiety and depression. So the doctors they were consulting me more and more. And in the summer of 2015, we had to go to Tennessee for classes. And I remember having such a hard time, and I would always think about, oh my God, I have to leave my son. I have to leave my son. How am I going to do that? I'm breastfeeding him. This is going to be difficult. I don't want to, I don't want anything to happen to him. And I kind of started thinking that, man, I started doubting my motherhood a little bit. Eventually, I was okay, but I discovered that through an assignment that we were given by my CBT2 professor, we were given homework, and our homework was to do mindfulness every single day for a period of, I think, 2 weeks. And so I started doing it, and what I discovered was in the moments when I was feeling very anxious or I was feeling very overwhelmed or I was feeling kind of like worried, when I would do mindfulness, I discovered that it really helped with calming my nerves and really making me feel like I was able to function better and um, just kind of be more at peace, more calm, less anxious. And so I continued that. I never thought to put two and two together in that moment that says, okay, maybe my patients who are experiencing the same thing could benefit from this intervention because it helped me. But now that I look back at it, I said, oh, that's something that I could have been doing all along. We all know that um, maternal stress on the fetus can really cause, the research show that maternal stress can cause uh, poor social behavioral issues, poor emotional regulation or decreased emotional regulation. And so, in some cases, anxiety symptoms and depression symptoms from the literature that I read can also, um, you know, cause stress, significant stress during pregnancy, which can also, stress can contribute to preterm birth in a lot of women. And so now that I think about it, my pregnant mommies who were going through significant stress, if I probably would have maybe worked with them more on this type of intervention, mindfulness based stress reduction, maybe it could have probably helped them as much as it did me in reducing the symptoms of anxiety and for some moms, the symptoms of depression that they're probably experiencing. I know that basically that there is a high level of moms who will experience what we know as postpartum depression. Like 1 in 7 moms could experience that as well during the postpartum period. And so I was thinking, what if this is an intervention that we can actually teach our moms or provide them homework to do? For me, exactly. Like, what if it's something that when they come to my group and they leave, I provide them with this um, intervention. I teach them how to do it and then give it them as an assignment. And then when they come back the following month, because it's only once a month, my group, so perhaps they could be practicing it all along after they've had my group, and then they come back, and then we can talk about whether or not it helped, whether or not it reduced the symptoms that they were experiencing. Because research does support that it does reduce anxiety. As a matter of fact, a study that was done by Christine Gordinoa in 2014 with pregnant moms who were experiencing anxiety did show that mindfulness based stress reduction, it actually did work to reduce the symptoms of stress and anxiety in moms who were experiencing that. They actually did a control group study. So one group got the intervention and the other group didn't get the intervention, and it did show that there was a reduction in the stress level over the 8-week course that they did it. And so I thought about that. And for most moms, they're probably not going to be able to go to a um, psychiatrist once a week or as often as it would probably be recommended if they are really experiencing significant stress. So I thought to myself, I said, what if we can actually teach moms this simple intervention during their pregnancy as a way to help them reduce stress at home when they're experiencing it, or when they have a baby and it's really overwhelming, teach them how to do it in the postpartum period and see how it will reduce their stress. And if it works for them, then it's something that it can become like something that's routine, something that we do as often as an intervention to teach mothers how to pretty much self-soothe themselves at home. Like when you're feeling really stressed out and overwhelmed and you really don't have anywhere to go because you have to take care of a baby, you can actually take some time out in your closet, which is where I did my mindfulness. I went in my closet and I locked the door and I found me a nice quiet place and I did my mindfulness homework. And so, what if this is something we could teach moms? Do it as a homework for you. Find a quiet place. I know that it's rough to get in a car and drive to a clinic. You can do this right in the comfort of your own home and, help to really reduce whatever it is that you're going through. So, I think that this is an emergent intervention. That's something that we can really look into for the future. Um, Christine Gordinoya's study, she did recommend that more research be done because it's not something that's often done within this population. And there is, a small amount of research out there that supports the intervention. And I think that it might not work for every mom, but it might work for some moms. And even if it's just some moms, because of all the adverse effects and because of that being a significant issue for moms, who are carrying babies, that, might be experiencing this significant level of stress, it's important for us to really provide them with some form of intervention that maybe they can use quickly. And, it's something that you can just snap into doing and really help you to refocus, help you to focus on and being the best mom you can be for your baby. Um, and also, being able to have something that you feel you can do right away is something that I think is beneficial, as opposed to really feeling defeated that you don't have anything that you can do. I know for me, it really did ground me. It really did make me feel refreshed. It really did make me feel like I can actually do this. And for the last two of my groups, I've actually incorporated mindfulness, and I did it with two of my patients, and they really loved it. And so for me, it was amazing to see that they actually were receptive to it, and they said, you know what? I could see how this can work for me. And so hopefully they'll continue to do this homework, and when they do come back to my group, they'll let me know that it really helped them with reducing the symptoms that they were experiencing. Stress is really something that can cause so many different types of ailments. And I think that really any way that we can reduce stress levels, we can reduce anxiety, we can reduce depression in patients, it's helpful for us to have someone who's a lot healthier. And we all know the important aspect that mom needs to be able to be alert and oriented and really be the best person she can be to really take care of her child. And at the end of the day, as a clinician, I feel like my duty or my job is really and truly to help these women as much as I can for them to feel comfortable enough to practice something like this and feel comfortable enough to really and truly feel like they can do it. Have the confidence, because one of the worst feeling in the world is feeling like you are a bad mom. There were moments when I felt like I wasn't the best mom, and so I know how these women probably feel. They feel like defeated in so many ways. And having something simple as mindfulness, I believe, could probably help them significantly. And I think for me in the future, it's probably something that I'll definitely want to explore more and really see if it does work with my population. And I know that, it's an ongoing process now. And I think, and I read in the literature that there's been over 1,300 or 1,000 publications relations to mindfulness, but there's only scanty, like not a lot of research pertaining to pregnant and postpartum women. So it's an opportunity for growth, and I think that it's kind of, an area that I definitely would like to explore a little bit more with my patients in the hopes that it grows. And who knows, maybe one day you'll see mindfulness being a part of the discharge plan, just as I incorporated or support group, and I incorporated or um, you're not alone video intervention. And maybe in the future we'll be incorporating teaching mindfulness intervention to moms so that they're able to reduce their stress level of anxiety and depression, when they go home or during their pregnancy. So I think, that's pretty much what I kind of wanted to get across today, and I hope that you guys enjoyed it. Thank you.